Hey everyone, Dr. Ritza here, downtown Toronto chiropractor, acupuncture provider, manual therapist, aiming to do the best part of your day. So one thing I invariably end up talking about with a lot of my patients is breathing. A lot of my patients suffer from neck or back pain, and little do they know that it might actually be their breathing pattern that might be perpetuating or contributing to this. Some of the emerging research that's coming out of the world of biomechanics is also showing this, that people with neck or back pain often have dysfunctional breathing patterns. At first it's a little tough to explain to a patient because they're like, hey, I'm living, I'm breathing, what could possibly be wrong? But I will explain that to you now. So what should be happening in the chief muscle of breathing is the diaphragm. It's a dome-shaped muscle that sits at the base of the lungs, and it contracts to flatten out, and when it relaxes, it comes back into that dome shape. When it contracts to flatten out, the lungs are allowed to expand down, and when their volume increases, air is able to come into the lungs so that we can breathe. Part of the process of the diaphragm contracting, which is important for low back pain, is it also compresses the abdominal contents down, and when it does that, it pushes back into the spine, which works to stabilize the spine and makes it more safe and secure. So we call this belly breathing, where the diaphragm is working to bring air in and out of the belly so that we're able to breathe. What we find with a lot of patients that have neck or back pain is they tend to be more of a chest breather. And what I mean is that they're using muscles like the sternocleidoid mastoid right here with the SCM, the scalenes, which go from the neck down into the first and second ribs, or the intercostal muscles that sit between the ribs. They're using these muscles to work to expand the chest out and try to get air into the upper part of the chest. So the problem with this is that these muscles aren't really designed for working 20,000 times throughout the day to move the chest, but rather to either move the neck around in the case of the SCM or the scalenes, or the intercostals and these other SCM and scalene muscles together to work only during extreme periods of exertion, such as running away from a cheetah in prehistoric times or exercising in present day times. Evolutionary wise, we should be using mainly our diaphragm to help us with our breathing. So when you think about it that way, if we're using a muscle that's not meant to be used 20,000 times a day to breathe, it's going to get stiff, it's going to get tight in the neck, and often cause muscle pain or decrease our range of motion and cause extreme sensitivity into the scalene muscles, through which that brachial plexus and the nerves going into the arms lead through, which can cause a whole number of other problems. As well as you think about for the low back, if that diaphragm isn't working properly to help stabilize the spine, other muscles that are supposed to be primary movers rather than stabilizers are going to be trying to stabilize the spine, and we get into a whole other world where back pain is of higher incidence and more of a risk factor. So what we're going to talk about today is we're going to talk about a basic activity using your shoes to show you how to properly belly breathe versus chest breathe. And we're also going to work on a progression so that we can work on the breathing musculature to actually strengthen that under resistance. Okay guys, so in this video what I'm going to do is I'm going to give you a couple cues on how to improve your belly breathing, show you what I do in clinic to work with my patients, give you an exercise to do at home to accentuate and master that belly breathing, and also give a progressive exercise for it. So what I want to see, or what I want to tell my patients for a couple of cues, what a belly breath should feel like is that you're pulling air in through the throat down into the tummy. So you should honestly be trying to breathe into your belly button. What we'll get you to do is try and feel a cue that your tummy is expanding in the front, expanding in the side, and expanding in the back, just like there's a tire going out and in through the midsection. So when we get somebody on their back in the clinic, I'll put my hand on the side of their core, and when they breathe in, I want to make sure that their hand that sits here doesn't go up a lot, so that their chest isn't doing all the work, and that when they breathe in, they feel the air coming down into their belly button, and that I feel pressure on my hand in the front, the side, and in the back. And what that looks like to me is you breathe in, and you can visibly see that my tummy expands. I can feel pressure in the front, the side, and the back, and that that the hand on my chest doesn't move upwards. What you can do at home for an exercise, you put a shoe on your tummy, a shoe on the chest, and what you want to make sure you're doing and work on is that rather than having the shoe on the chest go up and down, which would tell you that you're chest breathing, you want to make sure that only the shoe is rising when you breathe in. You can also use your hand on the side of your tummy to make that cue to feel the pressure in the front, in the side, and in the back as we draw air down into that belly button. And what that's going to look like is this. So what I recommend is doing that for about 5 minutes, 2 times a day. And not only is this going to be a fantastic way to work on your breathing, but it's going to be a great opportunity to take 5 minutes out of your day to be mindful, to relax from a stressful day, and to just focus on your body so that we can get rid of some of the nerves and some of the cortisol that's building up, especially for my patients in downtown. Okay everyone, so this is the progression exercise for some of the belly breathing work that we've just been doing. You'll see that I have a theraband tied very tightly around my belly button, and what we're going to work on now is our 5 minutes of belly breathing, but with resistance against the core. This is going to really enhance our ability to do this under pressure. It's going to make us really focus on expanding that abdomen against resistance by using that diaphragm. We also want to make sure that we have a hand on our chest so that we're not fighting the resistance by trying to belly breathe, or sorry, by trying to chest breathe. So get on our backs just as before. We have the theraband very tight. If it's cutting off circulation, you're feeling some numbness and tingling, please loosen it. Let me or another health practitioner know. So we have the hand on our chest, and we're going to do the same principles of breathing for 5 minutes with nice big belly breaths against the resistance of the band. So with the band, I can feel it's a lot more work, especially at the outer edges of my breath when the resistance band really kicks in, and I really have to focus on not using my chest to breathe. So fantastic exercise for those that have moved beyond our initial belly breathing exercises and are working on mastering that ability of stabilizing the spine and breathing properly.